Fundamentals of anatomy, physiology, and kinesiology in sports. Content. 1. Definition and importance of anatomy, physiology, and kinesiology. 2. Functions of skeletal system, classification of bones and types joints. 3. Properties and functions of muscles. 4. Structure and functions of respiratory system and circulatory system. 5. Equilibrium, dynamic and static and center of gravity and its application in sports. Define anatomy, physiology, and its importance. Anatomy. Anatomy is the study of science dealing with body structure and relationship among structures. Anatomy tells us the basic structure of body parts and their interrelationship. Physiology. The meaning of human physiology is study of body function. In physiology we study how our organs, system, tissues, cells work, and how their functions are put together to maintain our internal environment. Kinesiology. The term kinesiology is derived from the Greek word kinesis, which means movement or motion, and logo, or the study of. Thus, kinesiology is the scientific study of human or non-human body movement. Difference between physiology and anatomy. Anatomy. Anatomy examines and describes the structure of living things. Physiology. Anatomy looks at what it is, while physiology looks at what it does. Anatomy is concerned with shape, size, position, and structure, while physiology will be interested in production and role of liver in nutrition and regulating body functions. Importance of anatomy and physiology. It helps in study the effect of exercise on human body. It helps in evaluation of a player's capacity. It helps in preventing sports injuries. It also helps in providing adequate information of sports nutrition. It helps in speedy rehabilitation of sports injuries. It helps in improving the sports performance of a player. It helps the player to choose the sports according to his bodily structure. It helps in positioning of body during training session. It helps in recovery of fatigue occurred during training session. It helps in study ill effects of alcohol to human body. Importance of kinesiology. 1. The main focus of kinesiology is the study of the mechanical concepts related to human movement, which is beneficial for every individual even in their daily activities. 2. Kinesiology applies sciences like biomechanics, anatomy, physiology, and psychology to better understand how the human body responds to physical activity and various stimuli. 3. Kinesiology and physical education study the role of exercise, physical movement, and sports in the development of human health and happiness. 4. It helps to understand the interconnection between human structure and functions. 5. It provides adequate knowledge of movement to athletic trainers who can, then, try to prevent athletes from suffering injuries. 6. It provides knowledge regarding efficient movements as a part of daily living in order to achieve optimum quality of body efficiency. 7. The study of kinesiology and physical education may be used as the basis for a variety of careers, which include gym instructors, coaches in different sports, etc. Function of skeleton system, classification of bones and types of joints. Skeleton system. Skeleton system is a combination of various bones. These bones differ in size and shape. Children have 213 bones and adults have 206. Bones provides protection to our delicate organs. Skeleton system can be divided into parts. Axial skeleton. It consists of skull, sternum, ribs, hyoid bone, and vertebral column. Appendicular skeleton. It consists of upper limbs and lower limbs. Bones. Bones are composed of lime, certain salts deposited in network of very strong fibers which impart a great degree of rigidity to its structure. Types of bones. There are various types of bones. Their names are given according to their size and shape. 1. Long bones. 2. Short bones. 3. Irregular bones. 4. Sesamoid bones. 5. Flat bones. Long bones. Long bones are present mainly in upper and lower limbs. These bones work as levers in the body and make the movements possible. humerus, femur, ulna, and radius bones. Short bones. These bones are short in size and light in weight but quite strong, carpal, atacarpal, phalanges etc. Irregular bones. These bones are different in shapes. Vertebra is a good example of these bones. Some facial bones are also included in this type. Sesamoid bones. These bones are present in knees, patella. Flat bones. These bones are present where protection is needed, i.e. skull bone and ribs etc. Brain and heart is saved by these bones. Joints. A joint is an articulation or union of two or more bones. The articulation of bones sometimes separated by a thin membrane. Sometimes by tissues or fibrocartilage. There is free movements in such joints. Types of joints, mainly there are three types of joints. 1. Immovable joints. Bones of skull and face etc. 2. Slightly movable joints. Less movement, pubis joint. 3. Freely movable joints. Shoulder, hip joint etc. These joints can be further classified into various categories. Gliding joint. Hinge joint. Ball and socket joint. Saddle joint. A gliding joint, also known as a plane joint or planar joint, is a common type of synovial joint formed between bones that meet at flat or nearly flat articular surfaces. Gliding joints allow the bones to glide past one another in any direction along the plane of the joint, up and down, left and right, and diagonally. Slight rotations can also occur at these joints, but are limited by the shape of the bones and the elasticity of the joint capsule surrounding them. A hinge joint is a common class of synovial joint that includes the ankle, elbow, and knee joints. Hinge joints are formed between two or more bones where the bones can only move along one axis to flex or extend. The simplest hinge joints in the body are the interphalangeal joints found between the phalanges of the fingers and toes. In these hinge joints, the bones are able to flex to decrease the angle between them, like when making a fist or curling the toes, and extend to increase their angle to about 180 degrees when holding the foot or hand flat. A saddle joint is a synovial joint where one of the bones forming the joint is shaped like a saddle with the other bone resting on it like a rider on a horse. Saddle joints provide stability to the bones while providing more flexibility than a hinge or gliding joint. The bone sitting on the saddle can move in an oval shape relative to the other bone, similar to a condyloid joint. The best example of a saddle joint in the body is the carpometacarpal joint of the thumb that is formed between the trapezium bone and the first metacarpal. Ball and socket joints are a special class of synovial joints that enjoy the highest freedom of motion in the body thanks to their unique structure. The shoulder and hip joints are the only ball and socket joints in the human body due to the need for great motion at the end of the body's limbs and the vast amount of musculature needed to move and support such flexible joints. Two main components make up a ball and socket joint, a bone with a spherical head and a bone with a cup-like socket. Muscular system. The muscular system is a set of tissues in the body with the ability to change shape. Muscle cells connect together and eventually to elements of the skeletal system. When the muscle cells contract, force is created as the muscles pull against the skeleton. Skeletal muscles. Skeletal muscles comprise 40% of the body weight. They are named so because they are attached to the skeletal system. They are also called striated muscles as their striations can be seen when observed under the microscope. These muscles are responsible for locomotion, facial expressions, posture, and other body movements. They are also known as voluntary muscles as they are under conscious control of the brain. They can contract very rapidly and forcefully, but they also tire very easily and require rest after short periods of activity. Smooth muscles. Smooth muscles are small and spindle shape. They are called smooth muscles as their cells are not striated. They are also called involuntary muscles as their expansion or contraction is not under our control. These muscles contract much more slowly as compared to skeletal muscles. They are found mostly in hollow organs such as stomach, urinary bladder, and respiratory passages. Smooth muscles are also present in the eyes, where their function is to change the size of the iris and alter the shape of the lens, and in the skin where they cause hair to stand erect in response to cold temperature or fear. Cardiac muscle are found in the heart where they form the walls of the heart. They are long and striated but not as clearly striated as skeletal muscles. The rate of contraction of cardiac muscles is intermediate between smooth and skeletal muscles. Cardiac muscles are involuntary as their expansion and contraction is not under our control. Functions of muscular system. 1. Movement. Muscles give rigidity to our body. Skeletal muscles can yank and pull on the bones in the skeleton, resulting in body movements such as walking, chewing, running, lifting and manipulating objects with our hands. 2. Maintenance of posture. Muscles generate a constant contractile force that allows us to maintain an erect position or posture, without much conscious control. 3. Heat generation. Contraction of muscle tissue generates heat, which is essential for maintenance of temperature homeostasis. 4. Respiration. Our muscular system automatically drives movement of air into and out of our body. 5. Constriction of organs and blood vessels. Nutrients move through our digestive tract, urine is passed out of the body, and secretions are propelled out of glands by contraction of smooth muscles. 6. Pumping blood. Blood moves through the blood vessels because our heart tirelessly receives blood and delivers it to all body tissue and organs. Introduction to circulatory systems. The circulatory system consists of the heart, arteries, veins and capillaries. The blood circulation unites all organic systems of the body in a functional unity. The functions of the circulatory system are as follows. To transport nutrients and oxygen to the body cells. To transport carbon dioxide from the cells to the lungs. To transport hormones, vitamins, minerals, and other substances of immunity to various parts of the body. To transport heat, that is thermoregulation, and the appropriate distribution of blood to various parts of the body. The structure of the heart. The size of the heart is about the same size as the person's fist. A newborn body's heart weighs only about 20 grams. An adult person's heart weight is about 240 to 320 grams. The heart lies near the middle of the chest, between the lungs. The heart is situated closer to the front of the chest than to the back and slightly to the left side. Functions of the heart. The main functions of the heart are as under. Pumping blood to the lungs. Pumping blood throughout body. Regulating blood pressure. Regulating the heart rate. Respiration. Respiration is made up of two phases called inspiration and expiration. You inhale, breathe in, oxygen during inspiration. You exhale, breathe out, carbon dioxide during expiration. Respiration includes the following processes. Ventilation, the movement of air into and out of the lungs. Gas exchange between the air in the lungs and blood, sometimes called external respiration. Transport of oxygen and carbon dioxide in the blood. Gas exchange between the blood and the tissues, sometimes called internal inspiration. Structure of respiratory system. The respiratory system consists of the nose, the nasal cavity, the pharynx, the larynx, the trachea, bronchi, the lungs, bronchioles, alveoli, diaphragm. The process of oxygen supply to the cells and the transport of carbon dioxide from the cells is called respiration. In the lungs are spongy elastic organs and are divided into the right and left lung. The surfaces of the lungs are covered with a mucous membrane, the pulmonary pleura. Within the lungs, there are about 500-7 respiratory system include the nasal cavity, ovar cavity, larynx, trachea, bronchi, bronchioles and lungs with alveoli. No exchange of gases takes place in the area between the nasal cavity and the bronchioles. The trachea is a tube about 10 to 15 centimeters long and 2 to 2.5 cm wide. This hollow tube is permanently kept open and is lined with ciliated epithelium. The trachea is divided into two bronchi which enter the pulmonary lobes and end with a bronchial tree. Millions of alveoli situated with 100 to 120 square meters surface area for the exchange of gases. Capacities and volumes of lungs. The volumes of the lungs are determined with the help of a spirometer or sprograph. Tidal volume, it is the volume of air ventilated with one normal inhalation during ordinary respiration and amounts to 500 ml, 800 ml. Inspiratory reserve volume, it is the volume of air that can be inspired more after an ordinary inspiration. It amounts nearly 3000 to 3300 ml. Expiratory reserve volume, it is the volume of air that can be expired more after an ordinary expiration. It amounts nearly 1000 to 1200 ml. Vital capacity, it is the volume of air that can be expelled by the most forceful expiration after the deepest inspiration. It is composed of the tidal volume, inspiratory reserve, and expiratory reserve. It amounts to 4000 ml to 5500 ml. Residual volume, it is the amount of air that remains in the lungs even after a forceful expiration. This amounts to nearly 1200 ml. Total lung volume, total lung volume is the volume of air that the lungs can accommodate after a deep inspiration. It is composed of the vital capacity and residual volume and amounts nearly from 5000 ml to 6500 ml. Effects of exercise on respiratory system. Improved tidal volume. Training helps to develop the muscles of the thoracic cavity and this in turn increases the lung volume. This brings about an increase in the tidal volume. Improved vital capacity. As the lung capacity in general improves due to training, the vital capacity also improves due to training. This is due to the improvement in the tidal volume, inspiratory reserve volume and expiratory reserve volume. Breathing will be more rhythmic and regular. We had already seen that the training improves the tidal volume and vital capacity. Due to this, a trained person inhales more oxygen in one inhalation than an untrained person. Thus during rest the trained person requires to take fewer number of inhalations in 1 minute than the untrained to get the same respiratory minute volume. Similarly, during and after a load the trained person requires taking fewer number of inhalations than the untrained person to obtain the same amount of respiratory minute volume. Improved gas exchange capacity. Due to training, more capillaries are opened in the alveoli and efficient gas exchange takes place. More oxygen will reach the working muscles which will help or delay fatigue. Improved maximum oxygen uptake. Maximum oxygen uptake, max VO2, is the amount of oxygen utilized by the body in 1 minute. Max VO2 is a direct measure of an individual's work capacity. This means that improved max VO2 is increased performance. Faster recovery rate. Due to improved vital capacity and improved max VO2, the recovery after strenuous exercise will be faster. Improved aerobic capacity. Due to regular and proper aerobic exercises, the aerobic capacity improves. Thus, the individual can perform moderate work for longer duration. Second wind. It is a phenomenon characterized by a sudden transition from an ill-defined feeling of distress or fatigue during the early portion of prolonged exercise to a more comfortable, less stressful feeling later in the exercise. In the beginning of prolonged exercise, the performer may get a feeling of intense breathlessness, rapid shallow breathing, chest pain, throbbing headache, giddiness and pain in muscles. The second wind is experienced by different persons at different times. When one experiences second wind, he starts breathing more comfortably, he gets partial relief from muscular fatigue and pain in the legs and chest and head pain is relieved. Equilibrium. Equilibrium refers to the state of any object when all forces acting upon it result in zero change of motion for the object. In other words, when the sum of all forces is zero, the object is in a state of equilibrium. In all activities, whether stationary or moving, balance is an important factor. All activities demand stability and sometimes, instability depends on its purpose. Types. Static forces are balanced and body is at rest. e.g. a book lying still on a table. Dynamic forces are balanced but body is moving. Example: a fan rotating with uniform speed has a net 4. Application of equilibrium in sport. 1.2 People balancing on a seesaw. 2 In every sport, the athletes maintain stability by lowering the center of gravity by bending their knees. 3 Boxers can lose balance if they shift their weight on heels because the center of gravity must fall within the line of base of support for greater stability. 4 Dynamic equilibrium is required by a tennis player to change her/his position after hitting a shot. Center of gravity. 1 Center of gravity is a point at which a body balances or the point at which the weight of body is equally distributed. 2 It is a point in the body or system around which its weight is evenly distributed or balanced and through which the force of gravity acts. 3 Center of gravity is the intersection point of all the 3 planes and axis. 4 The center of gravity is the average location of the weight of an object. 5 The position of center of gravity changes depending upon the position of the body or object. Application in sports. 1 An athlete who bends legs will lower his/her center of gravity, which will result in greater stability for the athlete. 2 Center of gravity needs to be lowered for greater stability in sports like wrestling. 3 A jumper's center of gravity must lie on the base of support for greater stability while takeoff.